our next talk is, as I've been telling you to keep moving, is about that, about movement. Staying active. As you know, fatigue and pain make a life with Erdheim-Chester disease a little bit difficult. In addition to that, the muscular and neurological deficits make living with ECD a little bit more difficult, and exercising and keeping our joints healthy and our muscles healthy is very important, but we have limitations because of the disorder, the disease, our own personality. We might not like to exercise, and also side effects of medication. So to learn a little bit more about how to stay active, Dr. Mariona Violán will going to give us a talk titled Staying Active. She's a professor of physical education and sports sciences. She's local here from Barcelona in the Department of Sports Medicine, and she's a member of the Catalan Society of Sports Medicine as well. So please, let's welcome Dr. Violán.
So good afternoon, and thank you so much to the ECD Global Alliance, and especially Dr. Xavier Solaric to invite me. So, and second one, I'm so sorry about my English. It's not in a good shape for many 2 years that I am not speak frequently. So the most important thing for me is try to motivate you about why it's important and how it's important to be active. To have an active lifestyle, they have lots of benefits. We have benefits for longer life, and we have benefits who are absolutely immediate. And there are two who are important for you and for your family, which is better sleep, the best sleep, and also the less anxiety and feel much, much better. In fact, to have a good quality of life. But then we have lots of benefits who is a long term. We need to be active because we need to train for our life. So we are designed to move. Human beings are designed to move. And the one that we need, it's not to be sit. We need to be with movement all our life. But each person have an according situation, it depends on the disease, that they need to ask the doctor or the specialist with maybe the inconvenience to have one exercise or another. The top 10 benefits are very important for you, and here there are one of them, which is it's important to regulate about weight, to prevent obesity, to help about hypertension, helps to regulate diabetes, improve the vascular health, and improve the cardiovascular, not disease, but the cardiovascular performance. Also boost the response of the immune system, and they have to be active, very high exercise, improve the anti-inflammatory response. Then it's important because muscle, it's one of the important thing that we will talk later, which is very nice to have the muscle strength in a proper shape. And then improve feeling, well-being, a restful sleep, and altered emotional states. It's a big difference between moving and having the sedentary behavior. We know that the human being is designed to move, but always we try to have a chair, a sofa, a bed, and to be just in a lying situation. And then we know that this sedentary behavior increase all causes of mortality, increase cardiovascular disease, increase cardiovascular mortality. It's a very bad indicator about cardiometabolic indicators, increase adiposity and obesity, and also increase some types of cancer and cancer mortality. How we can just make a break? We need to make a break every 1 hour, every 2 hours. We need to stand up, have some mobilization, only for 2 or for 5 minutes. Looks like this 2 or 5 minutes, it works. And then it's very important. And every year is more important because we have more scientific evidence how many benefits are about on mental health and how important it's to be active, to have proper quality of life, and you have probably the increase of well-being, reduce stress, and also self-esteem. There are lots of benefits that we know that it's important even though any kind of condition. I am working in high-performance centers. I used to work with very high-level athletes. And training, physical training, it's important, but we are working very hard to the invisible training, which is eat, gestion of the stress, gestion of the emotional situation, and of course, a proper sleep. If we don't have this invisible training, no one is going to the Olympic Games. So that is the most important, and we know it's important even for the people who has a chronic condition. Here it's only one example. It's about 2 years ago in the European Society of Cardiology, the last guidelines, they ask about the sedentary behavior, and only 15 minutes a day, they have a benefit. So it's no excuse. Having 15 minutes a day, it's going for an outlet to buy something. So it's less minute, but we know that we have benefits. And now, let's me play about a game. Someone here know the difference between physical activity, physical exercise, and sports? Feel free and choose. Feel free. It's a game. So, physical activity is any movement that we are doing spontaneously. It's inherent to the human being. But if we are talking about the physical exercise, it's with a purpose. We know a plan, we know a structure, we know it's an exercise, a repetitive exercise to have an improvement. And this is the one that I really like to talk about, physical activity and physical exercise. But here we are not talking about the sports. Sports, it's with a regulation, they have norms, and it's more strict with a lot of physical training. And how do you know that the people have sedentary behavior? It depends on the age. If we are talking for toddlers, they need to be active more than 3 hours a day. They are machine movement. It's, everybody knows how is a toddler life. Then if you are talking about children or adolescents, we need 1 hour at least of physical exercise. And this an hour, it's not the physical education who is going to the school. So we need our children and adolescents must be active at least 1 hour a day. And then we're going to the adult, an adult with a chronic situation. And it's only 150 minutes a week. 150 minutes a week. So we have 40 hours having a sedentary life and only 150 minutes a week to having some benefits. And I am not talking about the training going to the Olympic Games. And why? Because the basic physical abilities we are losing from the 30 years, 4 years, and it's going down very quickly. So we need to train for life, having the motor skills, which is strength, endurance, and speed. And we need the coordination. To train the coordination, we need obviously the coordination and balance. And then we need the flexibility and the agility. What happens when we are going adults? We need to train all these kind of physical abilities. And why? Because from 30 to 40, look at that, how it's going down very frequently. So this is in Castellano, but it's easy to understand. The adult recommendation from the WHO, it's 150 minutes or 300 minutes a week, but also the people need to train about the strength, which is important to talk about the muscle. But then people who has the adult with a chronic condition, this chronic condition need a specific physical exercise, which is balance, strength, flexibility, coordination, and agility, which is a multi-component training. And also the most important one is going very quickly, step by step, and gradually about frequency, duration, and intensity. And it's important to have a prior medical supervision just in case they have any cardiovascular or any bone disease that should be a contraindication. But at the end, even people with a chronic condition can benefit from exercise. It just needs to be adapted and personalized. So what do muscles do? Muscles do only they maintain the posture. Yes, they maintain the posture, they maintain or producing movement, they stabilize the joints and generate head. But the most important one for us is the muscles, because contraction and relaxation, they generate some substance, and it's a very nice crosstalk between muscle and different tissues of the body. Probably the most important one is liver, pancreas, brain, nervous systems, muscle to muscle, bones, cardiovascular, lymphatic, and of course, an adipose tissue. And all these cross-talking are absolutely beneficial to having a healthy life. Exercise plan for patients must be safe, gentle, and functional, and also improve the mobility, reduce fatigue that my colleague before me, they were talking about fatigue and pain, preserve the muscle mass, and of course support the emotional well-being. Those are the goals: mobility, muscle strength, balance and coordination, reduce the pain, mood, sleep quality, and prevent the immobility and functional decline. Those are the recommendations for people who has ECD, which is a water-based exercise, which is not swimming. It's just making exercise inside the water. Walking, a stationary bike in a special reclination. And for me, important one is avoid high impact activities, just because bone, it's rather a gate point that we need to be very careful. All of these benefits and the recommendation also include yoga, Tai Chi, and all the exercise that increase the mobilization of the diaphragm, because the breathing and relaxation is important. When and where? If you try to do this kind of exercise in an outdoor, like parks, green space, or blue space, we have lots of evidence that the resultation is much, much better. And how much? How much is less than 150? It's okay. If you arrive 150 to 300 minutes a week, this is the best situation. And you are going more than 300 minutes, probably the benefits, they just make a plateau. And how much is enough? I will really recommend two kind of tests, which is the RPE, which is the Borg scale, and try to train between 4 and 7 about the numbers, which is the anaerobic system that is working much, much better for you. And also, this is probably the most easy one, which is the talking test. If you say, good morning, how are you? We are going quite well. If you say just, good morning, how are you? You are going in a moderate situation. If you cannot say good morning, you are doing a very vigorous exercise. And then it's no one size fits all. We need to be a very nice professionals. We need to ask every professional. Every individual is an individual, so we're looking for the equity, not the equality or the equality. So we need to look the patient in that face, ask whatever you want. If you want to go to the swimming pool, you will go to the swimming pool, but if you don't like to go to the swimming pool, I need to be an effort and just adapt the exercise for the people who I'm talking. Because the most important thing is to focus the prescription on the person, not in the disease. So remember, walking, physical exercise, and active leisure. Remember, and switch that active travel and active transportation, walking and biking. Use the stairs if you can, but not the elevator. If you can do exercise and all the activities in the nature, in the outdoors. And remember, less sofa, less chair, less screen if you are sitting, and try to manage about the stress. And my case message to finish is every movement counts. And this is this is one of my mentors, which is Dr. Carles Vallbona. Here, the people know very well in Catalonia, that always he is saying that it's important to stay active at any age and any condition, because everything will be great. So thank you so much.